Okay, good afternoon. I wanted to share a little bit of feedback and kind of some recap takeaway information from our FPP bootcamp with the associate dentist in Kansas City last week. Um, so if you look back at what the boot camp was about, it was about basically creating some and instilling some best practices and reminding each of the associates, and for us owner doctors as well, what some of the biggest, most influential, and most impactful things that we can do in our practice to connect with our patients, to create an urgency around starting treatment, to actually start treatment, and then following up going forward, what we can do to help execute that treatment well. So the discussion from Dr. Ghazal and Dr. Sharifian revolved largely around the PPE, around the meet and greet, about how that um, quick chit chat can be reframed as a fit chat to try to figure out what we can do to understand where the patient's coming from and essentially fit the dentistry that they need and want into their lifestyle. So we're trying to discover what some of those obstacles are, some of their chief fit issues from the standpoint of getting dental care started. So it's important that we understand them as humans and they understand that we're humans too. So that meet and greet goes a long way. If we do it well, if we execute it well and appropriately, it goes a long way to connect with our patients. We want to try to become more humanized. Sometimes dentists get a bad rap, I think, from a lot of our patients. They come in and they say, "Oh, no offense, but I hate you." That's true for a lot of patients. So if we can connect with our patients in a non-dental way first, and then dig into what brought them in, what's that chief condition, that chief concern, what the disability is, whether it's inability to chew, whether it's pain or discomfort, or whether it's concern, and then going on what the benefit is that we can offer them to help counteract that chief disability, and then manage those chief fit issues, those challenges that prevent them from moving forward with treatment. So that meet and greet can become really, really critical. Dr. Sharifian talked about how most of the times in his office, the meet and greet is actually happening in an operatory because their consult room just isn't big enough to accommodate that. If you can do it in the consult room, as Katie mentioned, do your best to take that lab jacket off if it's got any current dental grime on it. I know there are some PPE, some personal protective equipment practices there that we want to be cautious of with our patients. So do the meet and greet. Ideally, the doctor would escort the patient from the waiting room back to either an operatory or ideally a consult room. We can have that meet and greet, that fit chat in the x-ray room, but sometimes that's a little impersonal and can still be a little intimidating. So it's setting the patient in a non-dental chair, whether it's a non-dental x-ray chair or a non-dental treatment chair in the operatory, is part and parcel to having a low stress interaction with the patients. Okay, so let's see, what else do we talk about? We talked about the meet and greet. We talked about the PPE process. We talked about awareness, consequences, and concern, helping the patient understand, number one, here are the conditions. Taking good photos and x-rays, identifying conditions to the patient, and helping them understand what the consequences are. Most of the time, we as dentists are trained, at least in dental school, to go straight from the you have to the you need conversation, rather than the here's the condition we've identified, here are the problems, if left untreated, that could happen. So going forward, we want to prevent that from happening by executing this treatment. Here's what I'm going to give you. I'm going to give you the ability to chew comfortably. I'm going to give you the peace of mind of knowing that we've solved the issue or preventing an issue. So helping the patient understand what the consequences of their conditions are. And then gauging their level of interest in moving forward. We always want to check in with the patient, however you do that, whether it's, one of the things I like to say is, tell me what you're thinking. What are your thoughts right now? I know I've said a lot. Let's hear what you're thinking. Checking in with them to gauge what they want to do and what they're interested in hearing about. I think we lose our patients a lot, meaning lose their attention, lose their focus a lot if we're not cautious with regard to how we're having that discussion with them. Check in with them, gauge what they're interested in. I had a patient yesterday, really complicated treatment plan, a dozen or more teeth that needed extensive dental work. And as we were going through the teeth and talking about the consequences of the situation that he had, he kind of just, he put his hands up and kind of did this. And he wasn't doing this to me. He was just like, oh my goodness, there's a lot going on. So I took a step back. I kind of slid my chair back and I'm like, so tell me what you're thinking. What's going on? What are your thoughts at this point? And he said something like, well, that is a tremendous amount of work. I'm not sure I'm not sure I'm ready to go forward with all that stuff. And so we dug in, we narrowed the focus. We talked about, well, there are a lot of issues, but let's kind of zero in on what's most concerning to you and to me, come up with a game plan that's patient-centric, a treatment plan that's patient-centric. And then we focused on that. So of the 12 or more teeth that he needed extensive work on, we started with the top 2 or 3. And then we have a plan once we're done with those 2 or 3 items, one of which involved scaling and root planing. Of those 2 or 3 items, we're going to then reevaluate once we got those done and move forward with the next 2 or 3 teeth. So we're taking it in bites, basically. Next on the list was the HC handoff. And this is a really critical key piece of the puzzle. The more efficiently and effectively we can do a healthcare coordinator handoff, the easier it is for us to help the patient start that treatment today, or to at least get them scheduled to move forward with that treatment. And let me frame this discussion a little bit. The purpose is not to coerce or intimidate or manipulate patients into starting treatment. This whole process is designed to facilitate an understanding of the conditions, well, even before that, connecting with the patient, an understanding of the conditions, and then facilitate moving forward with treatment as quickly as we can. So the HC handoff involves an introduction, prioritizing what we want to do first, addressing what the chief condition or chief concern is, talking about what we're going to do to fix that, looking at what our next specialty treatment is, and then addressing that fit issue. We sometimes forget to acknowledge that there may be challenges for the patient to start treatment today. So if we can do that well, if we can connect now, take the information that we've spent 20 minutes with the patient gathering, putting together, if we can take that ball of information and kind of compress it and now hand that ball or the baton off to the healthcare coordinator, it's a lot easier for the patient to start treatment today, if you will, if they understand what's going on. And then following through, executing high quality dental care going forward. We did talk a little bit about CEREC and about best practices. We talked about having a clinical culture and making sure that you don't need to reinvent the wheel every time you diagnose, every time you sit down to make an appropriate diagnosis with your patients. It's really critical that we as providers have a written document. I encourage you to write it down and post it. A written document that outlines your standards of care. Now, these should be well above the minimum standards of care. But you should have something that's very clear from the standpoint of what the standards of care are in any given situation. For instance, for me, with regard to periodontal situations, unless it's pseudopocketing, which is easy to identify, unless it's pseudopocketing, any 4mm pockets with bleeding equals the recommendation for scaling and root planing, irrigation, and laser. That's a line in the sand that I drew based on science and based on the AAP guidelines, recommendations for scaling and root planing at 4mm and bleeding. So it's important, number one, that you have that clinical culture, but number two, that it's backed in evidence-based dentistry in science. So having that posted makes it very, very easy for you to follow through. And also, if the patients ever wonder, well, why are you recommending this? What are you doing here? You can always refer them back to the science. This is all based on evidence-based information. We want to do what's best for you in the long term, and here is why. And feel free, if you want to refer to the studies from which that information comes. Okay, so clinical culture documents really critical. I would encourage every one of you owner doctors, myself included, to have your clinical culture posted in a very clear, very visible place. We have it several places. We have it in the lab, break room, and in the consult room. It's posted. So if there's ever any doubt, it's there. No questions asked. We know where it is. Beyond that, following through with executing high quality care, standards of care with CEREC, standards of care with regard to executing same-day dentistry where possible, are really, really critical to making sure that going forward, the patients are receiving the highest quality of care. But really, it comes down to a simple solution, or a simple system, if you will, that's already in place. And PDS knows the system, it works. Many doctors do very, very well from the standpoint of patient-centric service, of focusing on what's best for the patients with regard to executing this system, the perfect patient experience. If we were to take and strip out all the language, all the acronyms that we use, it comes down to connecting with our patients, providing a good explanation of what's going on, treatment that we'd recommend based on science, what's necessary in any given situation, and then following through with a high level of care. That's what we talked about. That's what the FPP Bootcamp was, the Associate Dentist Future Potential Partner Bootcamp. That's what it was all about. And this system works. And as we talked about, the number of patients that we're seeing in the Midwest region in Missouri, Kansas, and Illinois is excellent. We have very good patient flow. The patient demand that's here is excellent. So we should be able to execute at a high level, meaning we should be able to serve our patients at a very high level from the standpoint of seeing and serving and blessing a lot of patients through our service. So hopefully this has been helpful. Please feel free to reach out to me. I'm happy to be a resource to you, provide some input, some feedback. Going forward, really the sky is the limit. Look at how many patients' lives you can impact in a positive way. If we frame our treatment, our proposals, our focus in that way, dental care can be, being a dentist, providing dental care can be very fulfilling. If we're focused on dollar signs and pennies and procedures, yeah, I think you're going to miss the boat there. You're missing the mark. Focus on the people, focus on the smiles, focus on how we're blessing the lives of other people. All right, thanks. Bye.